So what is blepharoplasty? So it is a surgical procedure designed to correct the droopy eyelids to remove the excess skin and the fat or the muscles to rejuvenate the upper or the lower eyelids. So it is performed for both upper and lower eyelids for the functional reasons and for the cosmetic reasons. So what are detailed types of the blepharoplasty? So upper eyelid surgery. In upper eyelid, it removes the excess of the skin that can droop over the eyes, causing a tired look. It might be obstructing your vision also. So common in older patients whose eyelids skin loses the elasticity with age. Often performed for both functional, that is to improve the vision, and for the aesthetic reasons to give you a proper look. So lower eyelid surgery. So it addresses the under eye bags called the puffiness or the sagging of the skin, the loose skin. So it removes or reposition the fat pad, smoothen out the contour between the lower eyelid and the cheek, and it also tightens the loose skin, reducing the wrinkles in the lower eyelid area. And third is the double eyelid surgery. That is, it creates a defined upper eyelid and also the lower eyelid. In the upper eyelid, the scar is always in the natural fold, and the cosmetic procedure, this is very common in the Asian population to enhance the appearances of the eye. And last thing in the procedure is the transconjunctival blepharoplasty. So this technique is used for the lower eyelid. It involves making the incision which is inside your eyelid. That is, the no scar is visible from the outside. All the surgery is done from inside. So ideal for the patients who has excess of the fat but there is no significant skin looseness. So result is without any external scar. So how the procedure is performed? So first is the consultation and the planning. So your surgeon will assess your eyelids, the skin elasticity, the fat distribution, and the muscle tone in the eyelids. So they may also perform some tests to check for the dry eye syndrome or other eye conditions. And photographs may be taken to guide for the surgical plan and for the comparison of the results after the surgery. So anesthesia, so it is always done under local anesthesia. We might give you some sedation depending upon the extent of the procedure and the patient comfort. So surgical techniques for the upper eyelid surgery, a small incision is made along the natural crease in the upper eyelids. So excess of the skin, fat, and sometimes a small amount of muscle is removed in the upper eyelid. The incision is closed with fine sutures, leaving a scar that blends into the crease of the upper eyelid. Lower eyelid surgery. An incision is made just below the lower lash line, or we have an option to make an incision inside the eyelid called the transconjunctival. So fat pads are either removed or they can be repositioned to create a smoother contour. So skin may be tightened, so we might trim the loose skin and suture it back with the very fine sutures. If we combine upper and lower eyelid surgeries at the same time, this becomes the double eyelid surgery. So incisions are made to create in the crease in the upper eyelid. Excess tissue may be removed, and sometimes we do the repositioning of the fat in the upper eyelid also. In the lower eyelid, the same we can do from outside or inside. We can do repositioning of the fat, we can remove the extra skin. So this is called the double eyelid surgery. So duration, it typically lasts from 1 to 3 hours depending on whether you're opting for both upper or lower eyelids at the same time. So recovery process. So immediately after the surgery, there will be swelling, bruising, or mild discomfort, and this might continue for 1 to 2 weeks. Sutures are removed from 7 to 10 days if they are not dissolvable, and vision may be slightly blurry for the first 2 3 days. So 1 to 2 weeks after surgery, so swelling and bruising gradually is subsiding, and most patients can return to normal activities after just 7 to 10 days. Makeup can be used to conceal the residual bruising after 1 week. So long term recovery. So final results are apparent at around 3 months when all the swelling has resolved. The scars have faded away over the time and they are typically hidden in the natural creases. So aftercare tips. So you can use cold compresses to reduce the swelling. Sleep with your head elevated on two pillows to minimize the swelling or the fluid accumulation in the eyelids. So avoid strenuous activities, heavy lifting and swimming for at least 2 to 3 weeks, and you should use the prescribed ointments or drops or oral medicines as told to you by your doctor, and you should avoid smoking which can impair the healing process. So, what are benefits of blepharoplasty? So, first is the aesthetic improvement. It restores a youthful, refreshed appearance to the eyes. It reduces puffiness, reduces wrinkle and the sagging of the skin, and it creates a more defined eyelid creases. And second is the functional improvements. It improves the peripheral vision, which is obstructed by the droopy eyelid skin, and it reduces the eyelid heaviness due to baggy eyes. Some people feel heavy, and it make them easier to open their eyes properly. And last is boost in the confidence. So many patients they report feeling more self assured after after addressing these concerns about their appearances. So what are the risks and the complications? So like any surgical procedure, blepharoplasty also carries some risk. So first is the infection or hematoma or the bleeding just after the surgery. Second is the excessive tearing or the opposite, the dry eyes. Third is the difficulty in closing the eyes fully, that is usually temporary and subsides over 2 to 3 weeks. Scarring, although typically the scarring is minimal and well concealed in the creases, but there can be some issue with the scarring, and rare complications such as ectropion, that is outward turning of the lower eyelid, is a dreaded complication if the surgeon cuts the skin aggressively. So there is outward turning of the lower eyelid called the ectropion. So, who is a good candidate? Age. So, most patients over 40 years, though younger patients with hereditary eyelid issues may also benefit. Health. The candidate should be in a good health without any condition like uncontrolled diabetes or blood pressure or any bleeding disorders. We have to rule out these things. And the eye health. The patient should not have severe dry eyes or glaucoma or other serious eye conditions. And last is the realistic expectations. So we should understand the psychology of the patient. The patient is understanding realistically what the outcomes are. Surgery can significantly improve the appearance but does not stop the aging process. Other surgical options. So brow lift. So your eyebrow can be lifted. So it addresses the sagging eyebrows that may contribute to the upper eyelid drooping. Second is the facelift surgery. It is usually targets your lower face or mid face. So we sometimes do facelift for the neck lift along with the blepharoplasty. So blepharoplasty is a highly effective way to restore the youthful or the refreshed appearance, and it can improve your vision. So it is essential to choose an experienced plastic surgeon or an oculoplastic surgeon to minimize the risk and achieve the best results.